And we are quite a lot of ahead of schedule. It doesn't matter. We have more time for informal discussions after the seminar there at the lobby, where the cocktails are waiting. But I'll try to summarize briefly what we have discussed and understood today, and kind of try to set the scene from our end, and very adaptive to your comments also on this aspect. The background for change, the reasons for the change, I think they are very clear, and Mr. Aho was able to very openly and clearly show that yes, we definitely need to do something, otherwise the healthcare take too much of our growth, and it may even eat almost everything from our future if we don't start acting now. The government is really committed. We could hear that Minister Hyssälä is ready for practically anything. She's ready for changing the laws. She has started to put together working groups, and there is the BOCA group, there is the Recife prescription group, and so things are in the government, and there's a very clear commitment there. We heard from our international speaker base very interesting results, and clearly we have tools, we have new opportunities, and one thing which I think we haven't paid enough attention to is the customer activation, which was clearly pronounced by Andy Wiesenthal this morning. We can clearly say cost if we want. This became evident by Larry Smith, and also via Ross Fletcher, who could show also the clear improvement of the service capabilities if and when we put in place certain digitalized systems, so that we can clearly and demonstrate in a demonstrable way show that when we have everything in one place, we can create a system where continuous improvement becomes possible. And I think that is something which is a kind of an opening of almost a new era also in the Finnish healthcare system if we get to this goal. The big question is, of course, the question of how to manage this, how to get there. Professor Saranummi was presented the plan, and that has been made all summer, and of course also before that. But the plan is now in between certain covers, and it will be presented to various parties. I don't mean political parties, but all parties who are relevant, and also the business will be exposed to this, and we will know during this calendar year, how will the final plan look like. But then comes the question that how shall we manage this? And notion was made that we need a national actor, and that has come up during various presentations. And the mandate of the actor is of course a political decision, and the laws which must be changed is related to this question. But then one thing which we haven't paid very much attention to is something which again was raised in the morning, that at the same time when this national actor gives certain kind of guidance on the architecture and specifications, and also probably something it needs help from the profession, so that certain practices and guidelines will be followed. The leadership question becomes important, and this is something I don't think we have paid very much attention to, and I don't want to interfere into the ministry's responsibilities and the POCA working group plans, but I think that this is something attention must be paid to, because only giving some legislation and some architectural guidance probably is not enough. This is too big endeavor to work out without a clear leadership. And maybe there is something we should work out a clearer plan. And of course, the financing is the issue which becomes imminent sometimes. And we are probably, of course, I'm not representative of the government, but it's difficult to foresee that the Finnish government set aside a large sum of money for this purpose, like in England, for NHS was done. I think we have to create more like a plan that where can we make some savings and use those savings to improve the system and use those savings for the digitalization process. So a kind of a business plan will be necessary, I guess, or I'm foreseeing. And this is something again to the national player for consideration, which I'm understanding that this day has produced for them to think. So the last thing I'd like to raise is the issue that we are in Finland in a rather favorable situation. We have large exposure to electronic health record systems. As Niilo Saranummi showed, there are various kinds of Pegasuses and Efficas and Eskos and whatever around the country. And so the profession is well aware and used to using this. And this kind of a bottom-up approach is simplifying this possibility to have a common system. When we get this national player top-down to give some guidance, I think we are coming to a very, very favorable situation to get this whole process to the goal within the coming years. But now the question is, how shall the national player be organized, and what will be the mandate, and how the leadership will be organized? I think these are the major issues which we are facing in the nearest future. I'm very open to further comments if there are issues you would like to raise. If not, I would first like to thank the speakers for taking the toil and come up north here. Luckily enough, it's not that cold yet. And we enjoyed very much your presentations. We thank you for this. And I also want to thank the audience for giving your time, full day to come here and spend it with us. I hope this has been helpful to you. I look forward. The process will continue. Thank you very much.